Through Orix, Orofacial Dynamics, what we're bringing back is the art of treating an orthodontic patient with aligners. We're doing, our x-rays are going to be traced. Even though there's a lot of doctors, there's no values on tracings. Well, there's value in positioning the teeth inside the bone. There's value on considering the best angulations for aesthetics. There's value on actually looking at what the effects of the face are going to be and the changes by moving the teeth out. When we're doing non-extraction therapy with aligners, what is going to be the effect of the face, what is going to be the effect of the bone, and considering all of that. So bringing that art back into the aligners will yield into a more predictable and satisfactory result on whether you can apply what you want. Sometimes by just basically saying, I want to do this non-extraction, and when you do and perform a VTO, you know that it's going to be almost impossible whether to do it or not. Maybe it's going to require a lot of stripping. But we want to bring that predictability of the result. It's not just basically a technician moving the teeth, but trained doctors actually doing the clean checks, doing what is called the simulation of treatments to make it to a point that is actually doable. And yes, we want to try to preserve as many teeth as possible. We don't want to extract anything. But if it's not feasible, then those cases the doctors will be informed what type of route they want to follow. And our goal is to be able to make sure that we have the joints, the bite, the aesthetics, the face, everything in harmony, taking care of the patient, and also bringing more predictable results. I don't want to see simulations that are just basically moving the teeth 3 planes of space because you can, but rather to bring something that is actually according to what the body will allow us to do. Everybody has limitations, every patient is different. Medicine is not an exact science, and not everybody fits a one single recipe like everybody's gonna do it and just follow this principle and every patient can be treated that way. It can't. So by doing this and following these basic rules again that we had through the art of orthodontics, that's what we're doing through Orix. Giving this back and doing it in a simplified way that our lab is making everything possible to ensure the predictability of that result. In terms of the plastics that we use for the aligners, we are following a different approach that companies think that one single plastic will fit all the patients, and it's not the case. There's more elastic plastics, there's a lot of ones that are super stiff, and they can be used at different stages. So Orix in our company, we use plastics in the way where they need to be applied. If you have a lot of crowding, you need a more super elastic plastic to start with, and then you move into a medium type pressure plastics. This will allow you to change the aligners more often, like every 5 days, speeding up the process and reducing even treatment time with aligners even more. So the key to success is a tri-layer, 3 different layers of the plastic sandwiched together that provide different elasticities. And then as you start getting towards the end, your teeth are lined up much better. You just need one that's a little stiffer to fine-tune the bite and the aesthetics, and that usually reduce the amount of retreatments you need to do. Traditional aligners sometimes use 3 to 4 refinements. That's been documented nationwide, and we're actually going to some cases that we don't need a single refinement up to maximum 1. It also depends, guys. Remember one thing, aligners, you have to wear them and use them. If you don't use them, they won't work. And a lot of refinements have to do because of not wearing the aligners. So, but when you apply the technology correctly, you use the right plastics, the results are gonna be guaranteed. And if you're not happy, you even get your braces for free.